And so why? Well, you're uncomfortable, you're restless, you're tossing, you're turning. You may not necessarily wake up, but you're certainly not getting to the level of sleep that we want and need for your body to do what it's designed to do.
Right, to
So
detoxify and remodel that tissue.
we live in a toxic world. I mean, there's no mystery to that. The average American gets exposed to 88,000 toxins. Less than 200 have actually been tested for long-term safety. So we live in toxic soup, and we just don't know the degree to how much it bothers us. And of course, a lot of this is genetic. A lot of it depends on where you live and what you're exposed to. Obviously, people that live out in farm country where they probably have higher pesticide, herbicide exposure. People who live in urban areas, it's more petrochemicals and mold and other types of things. So it's kind of, choose your poison, but control as much as you can. I don't think a lot of women understand that endometriosis really is an autoimmune problem. All
Mhm.
allergies and sensitivities at their core are an overreaction of your immune system. So we just want to retrain your immune system to stop overreacting so we can get you to a point where you can be exposed to this thing and it doesn't set off that inflammatory cascade anymore. If
Yes.
you're making a conscious choice to think as food as medicine and not just something you need to sustain yourself, you're really using this to reduce inflammation, keep your gut happy, keep your tissues happy, and eat nutrient dense foods. And you do that, I mean, a lot of chronic illnesses get better, including endometriosis. I remember my ex-wife used to describe it like, she goes, I feel like someone shot a bottle rocket up my rear end
Oh.
because a lot of these endometrial implants can get in and around the bowel, bladder issues,
Mhm.
irritable bladder, interstitial cystitis,
Mhm.
migraine headaches are very common. I think the red flag is like, when, young women are starting their menstrual cycle and from the get-go, it's already a problem. That for me is, worth investigating. So it's really about getting rid of all the junk food, processed food. You want to be eating foods that haven't been touched much by hands. When you go to the grocery store, you shop the perimeter of the store because that's where all the real food is. Everything in between is just kind of junk filler stuff. This is your life, it's your health. And if you feel compelled to do more than you're being told, then please do so.
Yeah, for sure. And I think I would just add one more point to the autoimmune component. I always describe an autoimmune condition as like a toddler having a temper tantrum. Those white
Yes.
blood cells they're deficient, they're weakened, but they're overacting. And because they want to keep us alive, they will find other tissue to act on.
Let's cut to the chase, figure out what's really going on so we can give solid
So
recommendations.
you can do some targeted treatment.
I kind of see endometriosis as kind of like a benign cancer.
Mhm,
Although it's
mhm.
not cancer, the way these cells behave because they grow at a different rate than your regular endometrial tissue. These implants, when you look at them under a microscope, have a little bit of cancer-like quality.
Mhm.
So it's not cancer at all. I want to be crystal clear on that.
Yeah.
But how the
It's not
cells
technically
behave
cancer, but it has an activity
but
similar.
metabolically,
Mhm.
we now recognize cancer as a metabolic disease.
Hey there, thanks for joining the conversation at Health University, where we're committed to making ourselves just a little bit smarter about our whole health and our reproductive health. Make sure to hit the subscribe button as well as the bell so you don't miss a future episode. Leave a comment below, especially if there's a topic you want to learn about. We're happy to know and to include that in our episodes. And since 1 in 5 people are determined to be struggling with fertility, share this with 5 people. You're bound to help at least one change the course of their fertility struggles and help realize their dream of family. We value your time and we keep these recordings as succinct as possible. But if you want to listen to the full episode, just click below and the entire episode is there at your disposal. Once again, thanks for joining us at Health University.